Good morning, and thanks for joining us. I'm Michael Cook, Division Chief of the Census Bureau's Public Information Office. I'm here with David Waddington, Division Chief of Social, Economic, and Housing Statistics. Today, we're releasing findings from 3 reports: income poverty in the United States, health insurance coverage in the United States, including state-level statistics from the American Community Survey, and the Supplemental Poverty Measure for 2016. After the presentation, we'll open up the phone lines to answer questions from the media. You can find resources on our homepage, census.gov. Click on the slider at the top of the page or go to the newsroom and you'll find an electronic press kit containing materials from today's news conference and media products including the news release, visualizations, and sound bites. You can also join the conversation on Twitter and Facebook by following @US Census Bureau. Without further delay, here's David Waddington, Division Chief of the Social, Economic, and Housing Statistics, to discuss today's findings. Thanks for joining us, Dave.
Great, thank you, Michael. Glad to be here. Thank you, Michael. Good morning, and thank you for joining us. Today, we are releasing income, poverty, and health insurance coverage estimates. Let me begin by summarizing the main findings. Median household income for the nation was $59,000 in 2016, an increase in real terms of 3.2% from 2015 median of $57,200. The official poverty rate in 2016 was 12.7%, down 0.8 percentage points from 2015. In 2016, there was 40.6 million people in poverty, 2.5 million fewer than in 2015. The supplemental poverty rate in 2016 was 13.9%, 0.6 percentage points lower than the SPM estimate for 2015. The percentage of people without health insurance coverage for the entire calendar year was 8.8%, or 28.1 million people. This was a decrease of 0.3 percentage points from 2015. We are releasing 3 reports today: income and poverty in the United States, health insurance coverage in the United States, and the Supplemental Poverty Measure, all for 2016. Once again, we are releasing the Supplemental Poverty Measure, or SPM estimates, at the same time as the official poverty estimates. The Income and Poverty Report and the SPM report are based on data from the Current Population Survey's annual Social and Economic Supplement. The Current Population Survey is the longest-running survey conducted by the Census Bureau and is the official source of the national poverty estimates. The estimates of official poverty rates are calculated in accordance with the Office of Management and Budget Statistical Policy Directive 14. The Health Insurance Report includes data from both the Current Population Survey and the American Community Survey. The American Community Survey is an ongoing survey that has a much larger sample size than the Current Population Survey, making it the recommended source of health insurance statistics for smaller populations and levels of geography. Let me start by giving more details about the changes we observed in income. This chart shows median household income from 1967 to 2016 in real inflation-adjusted dollars. Recessions, as defined by the National Bureau of Economic Research, are depicted in this and all time series charts in light blue shading. The median represents the point on the distribution of household income at which half of the households have income below it and half have income above it. Real median household income was $59,000 in 2016, an increase in real terms of 3.2% from the 2015 median. This is the second consecutive annual increase in median household income. Looking here at selected demographic characteristics, this chart shows household income by age of householder for 2015 and 2016. Notice the pattern with householders aged 15 to 24 having the lowest median income, and householders aged 45 to 54 having the highest median income. The real median income of households maintained by householders aged under 65 increased 3.7% between 2015 and 2016, while the median income of households maintained by householders aged 65 and over was not statistically different from their 2015 median. Next, we show household income by race and Hispanic origin of the householder. The real median income of households maintained by non-Hispanic whites, blacks, and Hispanics increased by 2%, 5.7%, and 4.3% respectively between 2015 and 2016. This is the second annual increase in median household income for non-Hispanic white, black, and Hispanic households. Among the race groups, households maintained by Asians had the highest median income in 2016 at $81,400, though the 2015 to 2016 percent change in their real median income was not statistically significant. Looking at household median income by region, households in the South and West experienced an increase in real median income of 3.9% and 3.3% respectively between 2015 and 2016. Comparing regional to national household median income, the medians in the Northeast and West were higher. The medians in the Midwest was not statistically different, and the median in the South was lower. While the median represents 1 point on the distribution of household income, other points provide additional information about the nation's household income distribution. For example, 10% of households had income below $13,600. 10% of households had income above $170,500. And 5% had incomes above $225,300. Changes in the relationship of these income measures and the shares of income they possess, shown in the full report, can indicate how income inequality is changing. Using the information about the income distribution of household income from the current population survey, we can produce a Gini index, a widely used measure of inequality. The Gini index indicates higher inequality as the index approaches 1. The Gini index is calculated using pre-tax cash income and was 0.481 in 2016. It was not statistically different from 2015. These next slides switch to earnings and work experience data for people aged 15 and older. Here, we see historical data on the real median earnings and female to male earnings ratio for full-time year-round workers from 1960 to 2016. The median earnings for men and women who worked full-time year-round were not statistically different from their respective 2015 medians. The female-to-male earnings ratio was 80.5% in 2016, an increase of 1.1 percentage point from 2015. This is the first time the female-to-male earnings ratio has experienced a statistically significant annual increase since 2007. This slide shows the number of workers historically by work experience and sex. Between 2015 and 2016, the total number of people with earnings, regardless of work experience, increased by about 1.2 million. In addition, the total number of men and women working full-time year-round with earnings increased by 2.2 million between 2015 and 2016. This is suggesting a shift from part-year, part-time work status to full-time, year-round work status. Now, we will take a look at poverty. This slide shows the official poverty rate and the number of people in poverty. The official poverty rate in 2016 was 12.7%, down from 13.5% in 2015. In 2016, there was 40.6 million people in poverty, down from 43.1 million in 2015. In 2016, a family with 2 adults and 2 children was categorized as in poverty if its income was less than $24,339. The difference between the poverty rate in 2016 and the poverty rate in 2007 was not statistically significant. This is the first year since the most recent recession where the poverty rate was not significantly higher than the pre-recession period. Here we demonstrate the difference in poverty trends across race and Hispanic origin groups. For non-Hispanic whites, the poverty rate was 8.8% in 2016, not statistically different from the 2015 estimate. The poverty rate for blacks decreased to 22.0% in 2016, down from 24.1% in 2015. For Hispanics, the poverty rate decreased to 19.4% in 2016, down from 21.4% in 2015. The change in the poverty rate for Asians was not statistically significant. This slide looks at poverty rates by age. For children under age 18, 18% were in poverty in 2016, down from 19.7% in 2015. The poverty in 2016 decreased for people 18 to 64 to 11.6%, down from 12.4% in 2015. People aged 65 and older had a poverty rate of 9.3% in 2016. The difference between the 2015 and 2016 poverty rate for this group was not statistically significant. The poverty rate for females has historically been higher than the poverty rate for males, but the difference has narrowed over time. In 1966, the poverty rate for females was 3.3 percentage points higher than for males. But by 2016, the difference in rates across females and males had declined to 2.7 percentage points. Age, however, matters. The narrowing difference in poverty rates across sexes from 1966 to 2016 was concentrated among individuals aged 65 and older. In 1966, the poverty rate was 8.5 percentage points higher among females. By 2016, this difference had narrowed to 3.0 percentage points. The average per capita income deficit provides a measure of how much income per person would be necessary to move individuals and families out of poverty. Families with female householders with no husband present in 2016 required more income to rise above the poverty line compared to other family types, while unrelated individuals experienced a larger annual income deficit than those living in families. While 12.7% of the population in 2016 were in poverty, 5.8% of the population had incomes below 50% of their poverty threshold, meaning the family or individual received less than half the income necessary to meet their poverty threshold. Among those in poverty in 2016, 45.6% had incomes below 50% of their poverty threshold. This slide looks at the proportion of people in poverty in 2016 with income below 50% of their poverty threshold by selected characteristics. While 45.6% of the total population in poverty had less than 50% of their income needed to reach their poverty threshold, this proportion was lower among the poor aged 65 years and older, as well as for Hispanics. Turning now to the Supplemental Poverty Measure. The Supplemental Poverty Measure, or SPM, extends the official poverty measure by taking into account many government programs designed to assist low-income families and individuals that are not included in the official poverty measure. Non-cash benefits, such as housing or nutritional assistance, are added to pre-tax cash income, while necessary expenses such as taxes, work, and medical expenses are subtracted. The SPM rate does not replace the official poverty measure and is not used for determining eligibility for government programs. The SPM uses thresholds produced by the Bureau of Labor Statistics from the Consumer Expenditure Survey. Separate thresholds are created for renters, homeowners with a mortgage, and those who own their homes free and clear. While the poverty threshold is constant throughout the United States on the official poverty measure, the SPM adjusts for geographic differences in housing costs. This map shows those differences, with yellow areas having lower thresholds for renters than the official poverty threshold, and blue and green areas having higher thresholds. This slide compares the SPM estimates for 2016 with the SPM estimates for 2015 for all people and by age group. The 2016 SPM rate for the entire population was 13.9%, 0.6 percentage points lower than the SPM rate for 2015. There were statistically significant decreases in the poverty rates overall, for children under 18 and for people 18 to 64 between 2015 and 2016. The SPM rates for adults age 65 and older had a statistically significant increase of 0.8 percentage points in 2016. This slide compares the SPM estimates for 2016 with the official poverty estimates for all people and by age group. The 2016 SPM rate for the entire population was 1.2 percentage points higher than the official poverty rate for 2016. Looking at specific age categories, the SPM rate was lower than the official poverty rate for children, but higher than the official poverty rate for people aged 18 to 64 and people aged 65 and older. One important contribution that the SPM provides is allowing us to gauge the effectiveness of tax credits and transfers in alleviating poverty. We can also examine the effects of non-discretionary expenses such as work and medical expenses. This graph shows the impact on the 2016 SPM rate of the addition or subtraction of a single resource element. Some of these elements, such as Social Security and unemployment insurance, are included in the official estimates. Other elements, such as the Supplemental Nutrition Assistance Program benefits and refundable tax credits, are included only in the SPM resource measure. Using this chart, we can see that 26.1 million people were taken out of poverty by Social Security benefits. 8.2 million people were taken out of poverty by refundable tax credits. 3.6 million people were taken out of poverty by SNAP benefits or food stamps. However, subtracting medical expenses from income increased the number of people in poverty by 10.5 million using the SPM. Now, I would like to turn to health insurance. Over time, changes in the rate of health insurance coverage and the distribution of coverage by type may reflect economic trends, shifts in the demographic composition of the population, and policy changes that affect access to care. Several such policy changes occurred in 2014, when many provisions of the Patient Protection and Affordable Care Act went into effect. Let me start by giving details about coverage rates for the population as a whole. In 2016, most people, or 91.2%, had health insurance coverage at some point during the calendar year, with more people having private health insurance coverage, 67.5%, than government coverage at 37.3%. Of the subtypes of health insurance coverage, employer-based insurance covered the most people, 55.7% of the population, followed by Medicaid, Medicare, direct purchase, which includes health insurance exchanges, and military health care. According to the current population survey, the percentage of people covered by any type of health insurance increased by 0.3 percentage points to 91.2% in 2016. Between 2015 and 2016, the rate of Medicare coverage increased by 0.4 percentage points to cover 16.7% of people for part or all of 2016. Between 2015 and 2016, there was no statistically significant change for any other subtype of health insurance. Here, on the right, we see the change in health insurance coverage rates since 2013, the baseline year before many provisions of the Affordable Care Act went into effect. The uninsured rate decreased by 4.6 percentage points between 2013 and 2016. The percentage of people covered by private health insurance increased by 3.3 percentage points in this 4-year period. However, of the two subtypes of private coverage, only direct purchase health insurance had a significant change. During this period, the percentage of people with government coverage increased by 2.7 percentage points. Among the subtypes of government coverage, the Medicare coverage rate increased by 1.0 percentage points, and the Medicaid coverage rate increased by 1.9 percentage points. Now, turning to socioeconomic characteristics. In 2016, people with lower household incomes had higher uninsured rates than people with higher incomes. The uninsured rate for people in households with an annual household income of less than $25,000 was 13.7%, a 1.1 percentage point decrease from 2015. The uninsured rate for people in households with incomes of $125,000 or more was 4.2% in 2016. In 2016, the uninsured rate for full-time year-round workers was 9.8%. For people who work less than full-time year-round, the uninsured rate was 14.8%, a 1 percentage point decrease from 2015. For people who did not work at least 1 week, the uninsured rate was 15.0%, also a decrease from 2015. In 2016, the uninsured rate for non-Hispanic whites was 6.3%, a decrease from 2015. This rate was lower compared with other groups. The uninsured rate was 10.5% for blacks and 7.6% for Asians. Hispanics had the highest uninsured rate in 2016 at 16.0%. As I mentioned at the beginning of the presentation, the American Community Survey has a much larger sample size than the current population survey. The larger sample size of the American Community Survey make it a useful source for measuring characteristics that we cannot measure or distinguish with other surveys. The large sample size also makes it ideal for looking closely at year-to-year changes in small subgroups of the population, such as single-year ages. This figure shows the uninsured rate by single year of age from 2013 in the lightest blue to 2016 in the darkest blue. According to the American Community Survey, the percentage of people without health insurance coverage at the time of the interview dropped for most ages under 65 between 2015 and 2016. These declines in the uninsured rate followed 2 years of decreases for all ages under 65. Younger adults tended to experience a larger decline than older adults. For example, the uninsured rate decreased by 2 percentage points for 26-year-olds and 0.6 percentage points for 64-year-olds. Adults aged 26 continued to have the highest uninsured rate at 17.5% in 2016. 3 notable sharp differences remained in 2016 between single age years, specifically between 18 and 19-year-olds, between 25 and 26-year-olds, and between 64 and 65-year-olds. The American Community Survey is also a useful source for estimating and identifying changes in uninsured rates at the state level. On this map, the darkest blue represents uninsured rates of 14% or more. The lighter shades represent lower uninsured rates, and the lightest blue category represents an uninsured rate of less than 8%. Here, beginning in 2013, the year before many provisions of the Affordable Care Act went into effect, most states are in the darkest category. Only 3 states and the District of Columbia were in the lightest category. Here is the map for 2014, the year many provisions of the health care law went into effect. In general, the colors on the map are lighter, as now 11 states and the District of Columbia are in the lowest category. Here is the map for 2015. Generally, the colors on the map continue to lighten. And here again is the map for 2016. Between 2015 and 2016, the uninsured rate decreased in 39 states. Statistically significant decreases ranged from 0.3 percentage points in Massachusetts to 3.5 percentage points in Montana. Now, 25 states and the District of Columbia are in the lightest shade of blue with an uninsured rate of less than 8%. Since 2013, the uninsured rate has dropped in all 50 states and the District of Columbia. Variations in the uninsured rate by state may be related to whether the state expanded Medicaid eligibility beginning in 2014 as part of the Affordable Care Act. The 2 maps shown here highlight whether or not states expanded Medicaid eligibility. The map on the left shows states that expanded Medicaid eligibility, referred to as expansion states, and the map on the right shows states that did not expand Medicaid eligibility, referred to here as non-expansion states. As of January 1, 2016, 30 states and the District of Columbia expanded Medicaid eligibility. In expansion states, the uninsured rate in 2016 was 6.5%. In non-expansion states, the rate was higher at 11.7%. Uninsured rates in expansion states ranged from 2.5% in Massachusetts to 14.0% in Alaska. Uninsured rates in non-expansion states for 2016 ranged from 5.3% in Wisconsin to 16.6% in Texas. Between 2015 and 2016, the overall decrease in the uninsured rate was 0.9 percentage points in expansion states, compared with 0.7 percentage points in non-expansion states. Medicaid eligibility, and therefore the uninsured rate, is often related to poverty status. The population with lower income may be eligible for Medicaid coverage, particularly if they reside in one of the states that expanded Medicaid eligibility. In 2014 through 2016, the uninsured rate was higher in non-expansion states than in expansion states at all levels of poverty. The uninsured rate decreased at each level of poverty between 2015 and 2016, except for people living at or above 400% of the poverty in non-expansion states. However, the overall decrease in the uninsured rate was greater in expansion states than in non-expansion states for all poverty status groups. That concludes my part of the presentation. Here again are the highlights. Median household income for the nation was $59,000 in 2016, an increase in real terms of 3.2% from the 2015 median of $57,200. The official poverty rate in 2016 was 12.7%, down 0.8 percentage points from 2015. In 2016, there was 40.6 million people in poverty, 2.5 million fewer than in 2015. The SPM rate in 2016 was 13.9%, 0.6 percentage points lower than the SPM estimate for 2015. And the percentage of people without health insurance coverage for the entire calendar year was 8.8%, or 28.1 million people. This was a decrease of 0.3 percentage points from 2015. Thank you, and now I'll turn it back over to Michael.
Thank you, David. Now we'll take a brief break as we prepare for the question and answer session for media. If you're a member of the media who would like to ask a question, please dial 888-917-8045 and enter passcode 613-5618 when prompted. We'll be right back. Welcome back. Now let's open the discussion to questions. Please state your name and media affiliation when you ask a question. We want to give everyone an opportunity, so we're allowing just one question and one follow-up question. Joining us now, in addition to David Waddington, are his counterparts from our Social, Economic, and Housing Statistics Division. Trudy Renwick, Assistant Division Chief for Economic Characteristics, and Jennifer Cheeseman-Day, Assistant Division Chief for Employment Characteristics. If you have additional questions following the news conference, please call the Public Information Office at 301-763-3030. Operator, do we have your first caller?
Thank you. Our first question comes from Chris Brugaber, Associated Press. Your line is open.
Hi, Chris.
Hi, how are you? Just to clarify, can you give us the historical context for the median household income, which appears to be at a new high, having just barely topped 1999, and give us a breakdown of, or remind us of the racial and ethnic breakdowns for those numbers as well. Thank you.
Thank you, Chris. I'm going to throw that income question over to Trudy Renwick.
Hi, Chris. Well, that's an interesting question. If you'll notice on our charts, you'll see a break in the line series, and that's because we introduced some new income questions in 2014, referring to income in 2013. And because of those new income questions, we are not making historical comparisons to any time before 2013.
Thank you for that question. Operator, do we have another call?
Thank you. Next question is Ben Loopsdorf, Wall Street Journal. Your line is open.
Hi, Ben.
Hi. You may not be able to answer this question either for the same reason, but I'm wondering when the last time it was we had such strong back-to-back gains. It seems like this is a pretty significant 2-year increase in the median household income.
Thanks, Ben. I'm going to throw that income question again back to Trudy.
Well, we can go back 2 years because we've been using the new income questions now since 2014. And you're correct, these are 2 consecutive years of strong income gains. I haven't made the statistical comparisons to previous periods, but this has been 2 consecutive years of very strong income growth.
Thanks for that question, Ben. Operator, do we have another caller on the line?
Thank you. Next question, Heather Long, Washington Post. Your line is open.
Hi, Heather.
Hi. Thanks for doing this. I know we keep asking the same question, but can you just clarify, is it wrong to say that it's the highest median income ever?
Trudy?
Because I think that's what a lot of people are going to look at this and take away. They're seeing the biggest number on table A1 of all time.
Well, we discourage people from making those comparisons because we really cannot tease out what is the impact of the change in the income questions, and the purpose of which was to gather more income, and the real changes in the economy. So for median household income, there was a 3% increase in income when we changed the income questions. And so we would discourage people from making those historical comparisons.
Thanks for that question. Operator, do we have another call?
Thank you. Next question, Tammy Luby, CNN. Your line is open.
Hi, Tammy.
Hi, thanks for taking this call. I wanted to double check with you whether the poverty numbers are also subject to that change, or can we compare historical poverty numbers?
And I'm going to throw that poverty question over to Trudy.
Okay. Well, when we made the change in the questions, we did it in what we call a split panel, so that we took a part of the sample and asked them the old questions, and a part of the sample the new questions for 2013, for income year 2013. And we found when we did that analysis is that the change in poverty across the questions was not statistically significant. So we are making those poverty comparisons going back. That's why we could say that the poverty rate this year was the first year that we had a poverty rate that was not higher than the pre-recession 2007 poverty rate.
And do the numbers change? Because you haven't updated yet your historical charts. They still show 2015 as the most recent number, but those stats don't change. They don't get income adjusted like income does, right?
Right. They do not. And if you refresh your browser, I think the new data should be up and live now.
Okay, thank you.
Thanks for that question. Operator, do we have another call?
Thank you. Next question is from Dominic Rush, The Guardian. Your line is open.
Hi, Dominic.
Hi there. Could you just to go back, everyone's going to ask the same question, trying to get some handle on how we do compare this figure, the median figure. How can we compare it? I mean, I know you're discouraging us from doing this, but everyone's going to. Can you try and give us a bit wider context on this year's figure?
Trudy, can you shed some more light on that?
Well, okay. Well, this year's figure, we can see that there was a significant increase in income over the last year, and almost every group had an increase in income relative to last year, and for most groups it was the second consecutive year of an increase in median household income. Unfortunately, when you want to go back further, you're going to, there's difficulty because of that change in the questionnaire. After many years of research and lots of consultation, we realized that we could do a better job of collecting income, and that's why we introduced the new questions in 2014. But that makes it difficult to compare across that divide.
But would it be possible, though, to compare it, how income recovered from the last recession to this? I mean, I know that you're not comparing exactly like for like, but is there a way of, can you talk a bit about how income has recovered since the recession compared to how it's recovered in previous recessions?
Well, well, one thing I would suggest for this recession is on Thursday when we release the American Community Survey data, that does not have, we did not change the questionnaire for the American Community Survey. So on Thursday, you'll be able to look at American Community Survey and look at the trends in median income back to 2007.
Thanks.
Thanks for that question and follow-up question, Dominic. Operator, do we have another caller?
Thank you. Next question is from Melissa Janko with American Academy of Pediatrics. Your line is open.
Hello, Melissa.
Hi, I actually just found the answer to my question in your data, so I'm good, thank you.
Could you say that one more time? Had a little difficulty hearing you.
I was able to find the answer in your reports, so I'm all set.
Okay, thank you very much. Operator, next caller.
Thank you. Next question is from Maria Pena from The Opinion. Your line is open.
Hi, Maria.
Yes, thank you for doing this. I realize that this is a lot of data, but I was wondering if you can zero in on Hispanics. From the data that I'm looking at, it looks like they've improved overall in terms of poverty and income. And I'm wondering if that reflects the previous administration's policies, and what does that portend to the current debate over Obamacare? Thank you.
Thank you for that question, Maria. I'm going to throw that overall question to Dave Waddington.
I can take a shot at that. I mean, initially, what we can say is that we did, as you pointed out, is it did see some of the overall findings that there were improvements in median household income as well as declines in poverty for the Hispanic population. What we're doing here is these data again reflect 2016 from the current population survey that we collected the data in February through April of this past year. So it reflects data for 2016. We can't really speculate as to what the causes are, but I can tell you we've been accurately collecting these data for over 50 years, and we're reporting them, and we'll continue to report and track these changes as we go into future years.
Thanks for that question. Operator, do we have another call?
Thank you. As a reminder for parties, press *1 for questions or comments. Next question is from Phil Gallowitz, Kaiser Health News. Your line is open.
Hi, Phil.
Hi. Similar question to the last one. How much of the drop in the uninsured do you attribute to the improving economy versus the changes in health policy?
That insurance question, I'm going to tee that up and throw it over to Jennifer.
Well, thank you, Phil. It's a good question. We really can't tease out the change between what would be the change in policy versus the change in economy with our data. Certainly we saw an improvement. We've seen improvements in the uninsured rate since after 2013 when many of the effects of the Affordable Care Act went into effect.
Thanks for that question, Phil. Operator, do we have another call?
Thank Thank you again. As a reminder, for questions or comments, press star 1. Stand by for next question.
And while we're waiting for our next caller, just to remind everyone, if you navigate to census.gov, you'll see in our slider image a direct link to today's press kit. And in that press kit, after the presentation, you'll be able to access the archived version of our video, as well as all of our background documents. Operator, do we have another caller?
Our next question comes from Binya Applebaum, New York Times. Your line is open.
Hello.
Hi, thanks very much for doing this. I know everyone keeps asking about this, but I want to get back to the comparability of data because it kind of blows my mind that you all can't comment on the comparability of data. That's surely the purpose of this data, and I wonder if you can address why it is that the census can't tell us how this compares to the historical pattern of household median income.
And I'm going to throw that question back over to Trudy.
Okay, well, once again, after many years of research on our income questions, in 2014 we made a number of changes to the way we asked income questions in our survey. And as a result of those changes in the questionnaire, we found we had an increase of 3.2% in income across the people who got the old questions versus the people who got the new questions. And so it's impossible for us to tease out now when we compare income in 2016 to income from the old that was collected from the old questions. We don't know what's driving that, the new questions or the changes in the economy. Unfortunately, this happens when we want to try to improve our survey, and so we did a split panel in 2013, so we could make that comparison between the old questions and the new questions. But that does mean that we can only compare with caution going back.
Can we infer that difference in 2013 is sort of a range of possibilities that it can be applied to this data?
Yes, I think that you could.
Okay, thank you.
Thank you for that question. Operator, do we have another caller?
Thank you. Next question is from Jen Fifield, State Line. Your line is open.
Hi, Jen.
Hi. Thank you so much for doing this. So I'm just wondering how to use this data on the state level, or if I should rely mainly on the ACS data to come out later this week.
Thanks for that question. I'm going to throw that over to Dave.
Yeah, I think that your response, you sort of answered your own question, is you're exactly right, is that the data from the American Community Survey, which has a much larger sample size, will be released on Thursday. That embargo, actually, the embargo release on the ACS data is at noon today, and you'll be able to access that data. But that data will provide much more information at the state level and all the way down into counties and lower communities.
Okay, thank you.
However, we do have state data that came out in the health insurance report, which shows the health insurance by state.
Okay, great, thanks.
Thanks for that question. Operator.
Thank you. Next question is Jordan Yadu, Bloomberg. Your line is open.
Hi, Jordan.
Hey, how are you? Just a quick question. Looking through the methods, I know you guys ask questions on about 50 different income sources, money sources. Are you able to see which contributed to this 3.2% gain, or if it was mainly job growth itself as opposed to increases in any of those categories?
Thanks for that. We'll throw that income question over to Trudy.
Okay, well, it's a kind of a complicated question. You can look at our detailed tables, and that will tell you by income source what the change in income has been. You notice that our household income went up by 3.2%, but our median earnings for full-time year-round workers was flat relative to last year. But we did look at this a little bit, and we found that the earnings of those households in the middle, the ones who are making up the median household income, their earnings were up. But we also saw a big jump in the number of people working and the number of people working full-time year-round.
Thank you for that question, man. Operator, any other calls?
Yes, thank you. Again, as a reminder, for questions or comments, press star 1. We have next James Denon with Mike. Your line is open.
Hi, James.
Hi there. Thanks for taking our questions. I had a question about the real median income household breakdown by age. I noticed that the income gains for the 15 to 24 cohort were almost 3 or 4 times as large as the other groups, and I was wondering if there's any kind of an explanation for that. Is it just because that group was the lowest earning to begin with, and it was easier for them to make gains, or is there some other possible explanation for why those gains were so high?
And that income question again will go to Trudy. Very popular today.
All right, thank you. Well, first of all, I think the first thing to point out is that it's a very small group, that's about 6 million households out of 120 million households. So it's a pretty small group, and if you'll notice from our detailed tables, it has a fairly large margin of error, about 5 percentage points plus or minus from that estimate. But that said, it did have the largest percentage increase. And you are right, it starts from a low number, so it's easier to have a higher percent increase. But that said, it had the largest percent increase of any group. And we looked at that a little bit, and it's definitely driven by an increase in the share who are working and an increase in the share who are working full-time year-round.
Thank you so much.
Thank you. Operator, our next call?
Thank you. We're showing no further questions at this time.
Great. We'll wait 1 second to see if we have any additional callers, but just to remind folks about this release, specifically, if you have any additional questions and you weren't able to get in, feel free to call the Public Information Office at 301-763-3030. Operator, we'll just check one last time to see if there's any additional calls.
Thank you, and we're showing no further questions.
Well then, thank you for joining us today for today's news conference. Before we wrap, I'd like to direct your attention to several key products scheduled for release. Starting at noon Eastern Time today, results from the 2016 American Community Survey will be made available under embargo for publication on Thursday, September 14th. This data set will provide single-year estimates of median house income, poverty, and health insurance coverage for all states and counties, places, and other geographic units with populations of 65,000 or more. It also includes estimates for numerous social, economic, and housing characteristics such as language, education, the commute to work, employment, mortgage status, and rent. As already noted, the 2016 American Community Survey health insurance statistics for states have just been released. Additional American Community Survey estimates will be released later this year. On December 5th, we will embargo estimates aggregating statistics over a 5-year period from 2012 through 2016 for public release December 7th. These estimates will be available for all areas regardless of population size, down to the block group level. If you have additional questions or wish to arrange interviews on the topics covered in today's news conference, please call the Census Bureau's Public Information Office at 301-763-3030. In addition, the general public may call our Customer Service Center at 1-800-923-8282 for assistance. I would like to also urge you to visit Random Samplings, the official Census Bureau blog. You will find a link to the blogs in the upper right-hand corner of our homepage. We have posted separate entries that dig deeper into the income, poverty, and health insurance findings we have just released. And just a reminder that you can also join the conversation on Twitter and Facebook, following @US Census Bureau. Please be sure to tag @US Census Bureau in your stories for social media. I'd also like to take a moment to thank our survey respondents. The Census Bureau conducts more than 130 surveys each year, including the American Community Survey and the Current Population Survey. Information from this and other surveys generates data that helps determine how billions of federal and state dollars are distributed each year. Respondents make this possible. For David Waddington, Trudy Winnick, and Jennifer Cheeseman Day, I'm Michael Cook. Thanks for joining us.